Hey everybody, I'm Dr. Shayna Keller and I'm back with an episode, and this week we're going to talk about fevers. We're going to do an introduction. What is a fever? The purpose of a fever, some myths about fever, and really the important piece that I want to touch on is the philosophy of disease as a process. Now, how does philosophy have anything to do with fevers? Stay tuned and you'll find out. I also want to talk about taking a temperature because a lot of people, especially through the pandemic, were using these really interesting thermometers, and does it really matter? We're going to find out. Of course, causes of fevers, there's three main causes. And what happens when your kid or your grandma has a fever? How do you manage it? What to do before you go flood urgent care? Because there's definitely a real thing called fever phobia. And lastly, the ways to support the fever. I use Triple H, and you got to stay tuned to figure out what that is. So let's get into it. So we're going to start with the philosophy of fever and acute illness. So what exactly am I meaning by that? Maybe you guys heard about the germ theory or the terrain theory. I know I was trained in the germ theory in school, Koch's postulates and Louis Pasteur, and you are sick because you have a germ and the germ makes you sick. Well, that's kind of weird because that's not why the body gets a fever. Actually, the immune system triggers the fever. So that's why I want to talk about this graphic disease as a process so you can kind of understand what I'm saying here. So you can see at the top, normal health. Right now, I'm not sick. I don't have a fever. I'm not runny nose or anything unusual going on. I'm not passed out on the floor, right? Obviously, that's a red flag and maybe something else needs to happen. So then we have some kind of disturbing factor. So say, that kid at the grocery store in the line that was picking their nose, then all of a sudden sneezes right on you. And for some reason, you're right at eye level because maybe you're grabbing a candy bar and just gets right in your mouth. All right, so you got exposed to said disturbing factor. And maybe also you were up late the night before binge drinking and not sleeping well, and because you were at a friend's wedding having a good time, right? Not judging, just saying there's multiple pieces that can come into. So now, the next day, you have a little bit of a fever and you have a runny nose and you just don't feel your best self. All right, so then you can see that this reaction comes up and you get a fever, an inflammation, that runny nose. Well, you can also see this is a normal process of healing. It's a discharge reaction. And what's our immediate response? Suppress the fever, suppress the runny nose, suppress the vomit, suppress the diarrhea. I'm not saying don't do those things, but I'm just questioning if that is the right process here, especially since those are triggered from the body, right? So I want to talk about germ theory and terrain theory kind of concurrently with this because there was a gentleman out of Nigeria, and please excuse my name pronunciation. His name is Son Ayuada, and we've pulled up the article so you can take a peek at this. When I pulled this up in 2017, he was a medical student, and hopefully by now he has graduated, but I really love the elegance of him marrying the two because in my mind, health is dynamic. It's not one or the other. It's oftentimes there's truth in various forms, and then we put them together, which he's done so neatly and calls the germ-terrain duality theory, which I really love. So the premise of terrain theory is that disturbing factor in that disease as a process is the only way a person gets sick. You have to have a dinged system, and that allows you to become sick. Versus germ theory is that kid sneezing on you, and that's how you got sick. So then we blame the sick little kids with their sticky hands for causing us to always be sick. But what if it's both? And I suspect that there's a lot of truth in the alternative medicine and conventional wisdom. If we can marry them together, how much more understanding we would then have about especially acute illness and, things turning into chronic illness, which we didn't even really get to talk about with the disease process. So you have to be exposed and be susceptible. You stayed up late at that wedding, having a great time, not taking care of the things that your body needs in order to thrive, and that kid sneezed in your mouth. Boom. That is the whole premise of the germ-terrain duality theory. So now that we've kind of understood how this can happen, and I want to go back to this disease as a process one more time here. So we get the disturbance in function, which causes that reaction, and then we suppress the symptoms. We take the antipyretic, ibuprofen, and Tylenol. We take the cough suppressant. We take the Imodium. We take the Mucinex, whatever it is. And then we've been doing that for 20, 30 years of our life, right? Since we were little kids. I know I was. That's how I grew up. And we end up with chronic illness, much like I did. And eventually that leads to degeneration. And there is a certain point in my understanding that there's only so much you can come back from degeneration. Like if you've got really severe rheumatoid arthritis, which autoimmune disorders in my mind are very much intertwined with suppressing of acute illness. And we'll get into that in a minute when we start talking about the immune system. There's only so much we can go back from taking that degeneration of the hands that turn into those really deformed shapes to come back from that. You're never going to get your bones to go back to fully straight fingers or straightish, depending on your ethnicity, right? So keep that in mind. This is slow medicine, but it's important. So why do we need fevers, right? It's a great question. And I did have an article that I pulled up from 2021. We'll link that in the show notes in the YouTube channel. So did you know that the immune system is the reason we produce fevers? It's not because of the bug. It's not because of the virus. It's not because of the teething. Those are the 3 reasons why we get fevers. It's because the immune system is saying, oh my gosh, we need to create a fire. We need to burn up this pathogen, the bad guy, so we can get it out of the system. Now, the problem is fevers are uncomfortable, right? And if you're anything like me, I really don't love seeing kids suffering. So we want to kind of soothe them and give them the ibuprofen and Tylenol. And something, that may have been privy to me during the pandemic, but it's in this article, Let the Fever Do Its Job, that we've linked below, written by medical professionals out of Poland and actually University of Tennessee, Knoxville. I used to live in that neck of the woods. They actually found some evidence that shows that taking antipyretics, fever-reducing agents, makes the illness last longer. Well, let's kind of think about that. We have suppressed the body's normal function and said, no body, your infinite wisdom, we don't want here. We want to feel better. So maybe it's time for us to embrace a little bit of discomfort so that we can actually get over colds and flus. Today it takes like 3 weeks compared to 20, 30 years ago. It was like 3 days and then people were better. But again, our immune system has been suppressed and stomped on. Okay, so fevers are generally self-limiting. That's the most important thing. Meaning once the immune system has done its job, fever goes away, it breaks. Really uncomfortable because you get that like nasty sweat that kind of saturates your pajamas in your bed. Really good to get that cleaned up and obviously wash your sheets after you've had a fever breaking episode. Okay. This means that the body is done and the pathogen has burned up and now the body's going to get the waste out, usually with runny nose, diarrhea, vomiting, cough, something of that nature to get the gunk out. Often in my profession as a naturopathic doctor, we say the cold is the cure. The illness is the cure. And again, no one likes feeling like crap, but the reality is we need to be acutely sick so we don't have chronic illness. And we have a severe chronic illness epidemic in the United States today. 1 in 4 kids has asthma. When I was a kid, that was like very unheard of. What about all these kids with severe peanut allergies and like severe allergies to all kinds of stuff? Like those were not normal. And I'm only 32. That was not a normal reaction when I was in the 90s going through school. There was no peanut table. Right? Like Southwest Airlines served peanuts up until like 3 years ago on airplanes because it's so severe that any amount in the air is problematic for these kids, which is awful. All right. So the immune system triggers the fever to get rid of. So what do we need to do if we're not using antipyretics? This is where Triple H comes in, and we'll get to those in a minute, but I want to share what those are. Herbs, hydrotherapy, and homeopathy. And, you're going to say like, we can't use those things. It's really dangerous. They're not proven. They're not safe in kids. Did you know, according to the WHO, that 90% of the world's population still uses herbal medicine as their mainstay of medical care? You want to know why? Medications are expensive. And the United States is one of the wealthiest countries. Also, this number 37th in healthcare and also number 1 in healthcare costs. So something that these impoverished quote unquote countries are doing correctly is they're not just relying heavily on pharmaceuticals. I'm not anti-med. I'm just saying there is a place for other items to be in our medical toolbox, in our medicine cabinet, rather than just pills all the time. Okay. So we've got a kind of idea of how the immune system triggers things. I want to talk about the importance of taking a temperature correctly. And there are some age limits to the oral temperature that we all well know and love. So as far as temperature goes, the most accurate is actually rectal temperature. And if you're anything like my dog, he will do anything to not have that temperature or thermometer go up his bum. And no one loves that, but it's the most accurate. The second most accurate is the one that was popularized during COVID, which is the temporal thermometer that kind of scans right here. And actually the most accurate spot is right here at the temple. It reads the temperature of your blood in your temporal artery. Okay. Price, it doesn't really matter on price. I would just look at reviews. What does it look like? Do people like it as a cheap piece of garbage that breaks after 3 uses? That's what I keep in mind. It's not necessarily cost that makes something be a better tool. So what else as far as temperature goes? Oral temperatures should not be done on anyone under the age of 4. So if you've got a 2-year-old that's dealing with a fever, which you should hopefully have a good pediatrician that's helped you walk through, especially if it's your first kiddo. That way you know what to do during a fever. Under 4, no oral. So get that temporal. Armpit and pacifier temperatures, which often are used at daycare centers, are the most inaccurate. They're a good, make sure everybody's in a good place, but they are not good temperatures. Obviously, rectal and oral, you can get a little bit more germy, so that's why people opt for those. But again, use that temporal one. I'm glad it was popularized during COVID. All right. So some myths about fevers. I alluded to this, the fever phobia. Oh my God, you have a fever. It's going to kill you. You're going to have brain damage. Yes and no. 102-degree fever, probably not going to kill you. I mean, there's always extenuating circumstances, but very rarely is a fever actually going to cause severe harm to a child or really adult at all. And as I was saying in that Let a Fever Do Its Job article, they found that fevers using fever-reducing supplements or antipyretics really impact the body's ability to overcome and produce antibodies. So, fevers do not cause brain damage unless it's 106 Fahrenheit for a sustained period of time. And by then, you already have a doctor or pediatrician on board using them wisely. I did have a patient, little boy, who had a chronic sinusitis, and he just gunk for days, actually months by the time they came to see me. He never got a fever. His brother got a fever, cleared it, totally not a problem. Well, we triggered a fever in this kiddo. And I was watching very closely. Fever was triggered within 36 hours of starting the homeopathics. This kid got 105-degree fever, sustained for 14 hours. It was pretty scary for mom. And I said, Mom, is the baby still wetting diaper? Is he still breastfeeding? How is he playing? Yeah, you can tell he's visibly uncomfortable, but he's still feeding and he's still having wet diapers. Okay, so we're watching and waiting. Mom did the right thing by getting me on board, and we're looking for signs of, is this a severe situation, which we'll talk about here in a minute. Okay, the other thing, febrile seizures. Febrile seizures are generally benign and self-limiting. Most kiddos that have them won't have them after age 6. They do not cause permanent brain damage, but obviously if your kid's having a febrile seizure, you need to get a doctor on board, go to urgent care, do the thing to make sure everything is okay. That's very important. Okay. And I'm going to say this again because it's worth saying again because it takes 7 times for someone to hear something the first time correctly. Antipyretics like ibuprofen, Motrin, and acetaminophen will not prevent seizures. They will make a child feel more comfortable, but they will suppress the immune system, which produces the fever to burn up the illness and get it out of the system. So 2 things are going to happen. Your kid's going to be more comfortable, but then they're sicker for longer. Or in that 18-month-old case, he was sick and never cleared the infection because his body wasn't able to mount a fever for whatever reason. Fever is a good thing long-term. Those antibodies that are produced by our B cells, part of our immune system, happen when we have that fever. The body is creating. So the next time it gets exposed to that chronic sinusitis goo, the body says, oh, I know exactly what this is. Take it out. Put it in the immune system jail. Okay? 3 causes of a fever. Bacterial, which generally lend itself to higher fevers. Viral, very rarely do viral infections reach 102. And that's why most adults, they don't get good fevers because most of the junk we get as we age are viruses. And 3, teething. This one always scares my parents because they're like, man, my kid's teething. They're just uncomfortable. They're breaking teeth. I mean, it's a neurological reaction. We've all had that happen, and hopefully none of us remember unless we have just exceptional memories. But, cold things. One of my parents, she really liked frozen blueberries. Help the kid chew on them. They always have those plastic things that you can freeze that have the gel in them. Try to avoid plastic in the mouth when we can. But, when a kid is uncomfortable like that, getting that cold on there really helps. And actually, that's hydrotherapy, putting that cold on there to reduce that inflammation, which is fever, hotness, swelling, and redness. That is what inflammation is. All right, so managing a fever. and when to get a doctor or urgent care on board. And I've already said a couple of those. So the most important thing is you keep your kid hydrated, whether that's with breast milk, whether that's with water, whether that's with another source of hydration like milk, cow milk. Okay, very important. Also, herbal teas are very helpful if age appropriate. Rest. So important here. You know, if the kid's playing with their blocks and they're like being relatively benign, that's fine. But you don't want them running around. You don't want them at daycare. You really want them at home where they're kind of pacified. Now, hydration is not the same thing as starving a fever. So there's an old adage called starve a fever, feed a cold. Everybody's always so worried, oh my God, my kid's not eating. Children's bodies have a lot more wisdom than adults. We often, as adults, override our natural functions that we have because, like, we've been told, oh man, if we don't eat when we're sick. But the problem is with eating when you have a fever is your body is busy. Your body is burning up that pathogen in your system to get it out. And now you just ate something. Okay, so now you're telling the body to pause on its immune system function and go digest food. It takes time away from burning that pathogen up that it could be doing and getting that over with ASAP. Now, what about this whole thing of feed the cold? Well, colds generally don't have a fever because most colds are viruses, right? So maybe you get 100.4, which is actually the technical definition of an actual fever. 99 is not a fever, people. So staying hydrated, starve that fever. It's okay. Even if the kid doesn't eat for 3 days, totally okay. As long as they're wetting their diapers and they're feeding appropriately. Again, they're going to be uncomfortable, but they're going to come back out of that fever and they're going to be so hungry. Okay. So when do you get a doctor on board? Fever over 104. Like that parent with 105, I was on call. I was ready for her call if she was calling me in the middle of the night. And I said, hey, if this, and this happen, we're sending you to urgent care. If you have a child under the age of 3 months, you need to go see a doctor. Their immune system is not developed enough. Something is more significantly wrong if a kiddo under 3 is getting a fever. Febrile seizures, very scary, often self-limiting, but again, always good to get a doctor's perspective, eyes on the kid, make sure everything is fine. Doesn't matter what the temperature of the fever is. I don't care if it's 101 or 105. If the kid is lethargic, they're not feeding, they're floppy. They have that floppy baby syndrome. They're not responsive to you as a parent. They're not like engaging with you at all. That's scary. They need to go in immediately. That could be something much more severe like meningitis, which is pretty dangerous. All right. So let's talk about Triple H. No, not the WWF wrestler, herbs, homeopathy, and hydrotherapy. Okay. Herbs are some of my favorite things. And as I alluded to earlier, they are used internationally around the world and are very, very safe. At least the couple that I'm going to talk about for kiddos today. I really made sure to pick ones that were age appropriate and safe for pregnant women as well. So some of my favorite herbs to use are yarrow, elderflower, chamomile, catnip, and I actually just had a family member reach out to me about catnip and is that appropriate thing for helping to break a fever in a child. And sure enough, it is. Spearmint, peppermint, lemon balm, ginger, and linden. So I want to talk about a couple herbal actions that are important for people to understand here. So catnip is a diaphoretic. Diaphoretic supports the body's need for fever and gently raises that temperature. So if the kid's sitting at 102 and they've been sitting there, they're totally fine playing with their blocks. And you're just like, come on, kid, when are you going to break this fever? Like, we got to get going here. We're supporting the body's function by giving them a warming thing like catnip, right? So that's a diaphoretic. Nervines, so kids uncomfortable, right? That's why we want to give them the ibuprofen or the children's Motrin. So what if we gave them something like lemon balm, or catnip is also a nervine. Nervines help to calm the nervous system. That way they're a little bit less fussy, especially if teething is on board. Those kids can be just a pain in the butt to deal with. And I don't know about you, but some of us really like to sleep in the middle of the night, right? So as long as the kid's okay. So nervines calm the nervous system, relax the muscles, and dilates the blood vessels so that there's less muscle tension. The blood pressure is kind of a little bit lower, so the blood is actually circulating through. The immune system can actually burn up wherever the pathogen is hanging out. Maybe they're hanging out over here in the arm. I don't know. Bitters stimulates digestion and calms the nervous system. And, we're going to go through these, but the reality is most herbs are not just one thing. Like, Ibuprofen does one thing in the body. It suppresses the inflammatory response of the immune system so that you don't get that fever, and it calms things down, which has a cascade effect. But the great thing about herbs is they have multifunctions. So catnip is a diaphoretic, it's a nervine, it's a bitter. It's a carminative, which we haven't talked about. So bitter and carminatives are kind of opposite each other, but they both work on the digestive system. Bitters stimulate digestion. So if the kid is tending towards constipation during the fever, it also calms the nervous system. Carminative. So the kid tends towards gas and bloating, but it also calms the nervous system. So things like chamomile is one of my favorite things here, which is a diaphoretic, but also relaxes if there's any kind of GI disturbance going on, which is really common with fevers, right? Obviously, there's antiviral herbs like elderflower. There's antimicrobial, which means antiviral, antifungus, antibacterial. It's kind of the whole spectrum there. A lot of herbs are modulators. What I mean by that is they regulate the inflammation response. They don't just decrease it. They don't just upregulate it. It's whatever the body needs. That's why I really love herbal medicine, is because it works in synergy with the body. And in some strange way, we haven't really figured out entirely, but herbal medicine has thousands of years of experience compared to modern medicine that's been around for barely 100 years. Okay, so inflammation modulating and then immunomodulating, similar to inflammation modulating, except pertaining to the whole immune system. And again, increases or decreases as appropriately to what the body needs. Okay, so I'll put a recipe down below for fevers, but one of my favorite recipes is written by Mary Bove, who's a well-known ND pediatrician. Chamomile spearmint. Spearmint's kind of got like a warming flavor. Chamomile is a little bit more soothing, but again, both of these are going to help support that fever. So the kid's a little bit fussy. You want to give them something. You can even make popsicles if you really want to go down the total crunchy mom route. Boil some water, put some chamomile, put some spearmint. Hopefully you have an herb shop near you. Otherwise, look at the tea section in your grocery store. Most grocery stores carry things like yogi tea and traditional medicinals. I really love traditional medicinals. They're simple formulas, and you can get something like straight spearmint, straight chamomile, whereas yogi teas tend to be a little bit more blend specific and add a bunch of other stuff and some natural flavors, which I'm not against, but it's always nice when you can get what you're specifically looking for as opposed to a whole formula, which may not be child appropriate. Okay. Boil some water, put the herbs in it, cover it. Always with these herbs, all of these herbs I listed off have some essential oils, and those are good medicine. So we want to keep those in. That's why you want to cover it when you're steeping your tea, so that medicine stays in there and doesn't just steam right out. Okay, the essential oils are especially helpful if there's like a cough or some kind of lung, respiratory, and some bladder components. Both of those really enjoy the essential oils from the herbs. All right, where did I put a little asterisk next to that? So you make notes, and sometimes you don't always remember why you made the notes. That's the way it goes. All right, so one of my favorite herbs, we're not going to talk about all of these, but we've attached this handout, I believe, going through some of these herbs. Lemon balm is one of my favorites, and kiddos are they're exposed to all the yuckies. And, there's a joke of like, oh, school's getting ready to start back up. My kids they've been fine all summer. It's warmer, playing outside, better immune function. We're not sitting inside all the time, right? We're dynamic creatures. So lemon balm is something a lot of people grow in their gardens because it's a beautiful plant, but it's also a great thing to have on board in your medicine cabinet so you can make some nice tea for those like coughs, colds, upper respiratory gunk, and it tastes pretty good. Generally, all of these herbs that I've mentioned, with the exception of yarrow can tend to have a little more bitter. Most kids don't really love that, but if you pair yarrow with some catnip and chamomile and some elderflower, some peppermint, ginger, linden. Linden trees are very commonly grown around here, although they're native to Europe. I met a man once who was from Austria, I believe, and I was harvesting from a tree last year. And he was like, oh, what is the English name for this? And I said, oh, it's linden. He says, oh, in my country we call it lipa. And I was talking to a friend recently from Serbia, and he was like, oh yeah, that's what we call it too, in his native tongue. Linden is a relaxing nervine. So think about that kid that's teething. They've got a little bit of a fever. It's also going to help break that fever because it's a diuretic. herb. So make some nice tea. You can make some popsicles. Really, there's some really great herbal references. Although I will say it's important whom you are getting your herbal information from. I just saw something online that was blatantly wrong, and it made me check myself. I was like, wait a minute. Do I know this herb as well as I think I do? Someone was saying that it contained a substance that it did not contain. So not everybody is an herbalist, despite their credentials. Really make sure that you are doing your due diligence. You're seeing the same piece of information cited on multiple websites before you go down that path. And always, always don't take advice from random people online. I don't care what my degree is. I'm not your doctor. I don't know you. You need to consult with your physician, your herbalist, someone that you trust before you take advice from some person online. Okay. So let's talk about hydrotherapy. That's the the second H of Triple H. Hydrotherapy, kind of like those cold blueberries we were talking about earlier, tend to be things like warming socks, sauna, tepid baths, or warming baths. Notice I did not say cold baths. Do not put your kid with a fever in a cold bath. That's ridiculous. You're going to shock the system. So everything's about like gentle. All of these herbs I've talked about are very gentle. These are not like going to force anything to happen. So when you would consider a tepid bath with something like apple cider vinegar, which is a pain-reducing substance, your kid's got like 104, 105 degree fever. They're really uncomfortable. You know, you're going into like hour 6, 7 of them having this high fever. They're still peeing. They're still drinking water, right? They're still staying hydrated. Those are the key things. But you want to kind of make them feel a little more comfortable. Run a tepid bath. That's like body temperature. So like about 98, 100 degrees. You know, and you don't want them, get them fully in there, maybe like a few inches of water, 6 to 8 inches in the tub, get them in there, take a washcloth or a sponge and kind of gently cool them down on the back of the neck, on the forehead, you know. And I don't know about you, but like I grew up with a Mexican grandmother and she had all these really interesting things about the cool washcloths, but not too cold. And so it's interesting that how these like old wives' tales kind of come out as truth later on. Okay. Now, sauna, obviously, you're not going to put an 18-month-old in a sauna. But if you yourself, as an adult, are dealing with a fever and you have access to a sauna that's not in a public facility, that way you're not getting other people sick, awesome. So sauna therapy helps to stimulate the production of that fever. And as long as you're feeling okay, you're not woozy, you're not lightheaded, you're not feeling like you're going to pass out, and you're staying hydrated with electrolytes, that's an appropriate thing to do. And often something I will do with someone that has chronic illness, because I have patients all the time. I haven't had a fever in 20 years. I don't ever get sick. Well, actually getting sick is important because it gets the gunk out of the system. Remember, we got to have those discharges to get back to normal health. Okay. I talked about warming socks. This has historically been called cold socks. So it's two things. It's a cotton pair of socks and a wool pair of socks, or a wool blend. Pretty hard to find full wool socks these days. So you're going to take a thin pair of cotton socks about ankle high or so, wring them out with cold tap water. You're going to put them on. I know, it's so uncomfortable. And as one of my older patients shared with me, she's like, it's the worst thing ever, but it works so damn well. And when I can help an older person feel a lot better, a lot quicker, because their immune system just isn't as strong as a kiddo's generally, they're pretty happy about it. And then you're going to take that wool sock, you're going to put it on over. You can do this during the day, if they're kind of, hanging out at home with you, or before bed. Put them on before bed. I really like doing that because they really get a chance to draw down and out some of that fever, help the immune system optimize itself a little bit better. When the kid wakes up, usually, in most cases, it's in the middle of the night, they'll kick those socks right off. That cotton sock that was wet with cold water is often dry, like it's been sitting on a clothesline, and it smells bad because it's pulling out junk from the body. Okay. So like the teas, the catnip tea, the yarrow tea, the chamomile tea, you can make a medicated bath that helps to induce that fever. But if the kid, for whatever reason, is just not interested in having things in their mouth, my mom used to do like ice chips with me, like ice cubes to get me a little bit of water when my stomach was really upset. So that's definitely something you can do. But also these herbal infused bathtubs. We've got skin. Our skin is really absorptive. So you can do that, but again, tepid. Okay, we talked about the cold washcloth on the neck and the forehead to kind of help ease that. Now, what about the third H of Triple H? This is the one that's most controversial, and is homeopathy. Homeopathy, I don't see being super effective for adults. And that's just because we as adults have a lot more guards up. But if you can get more comfortable using homeopathy with your kids, that's where I have seen some really cool things. And, placebo effect, maybe it is placebo. In my mind, we should be harnessing. I don't think it's placebo, but because kids don't generally have that concept the way we do, I have seen homeopathy be very effective in kiddos and animals. And again, animals don't even have the same concepts around this stuff that we do. So homeopathy, the way it works is it's strictly energetic medicine. There is an imprint, usually from a toxic substance that has been diluted so significantly that it's just the energetic imprint of what a poisoning of that substance would look like. So you've probably seen a kid like this. Boom, all of a sudden they have a fever, they were totally fine, and then 2 hours later they're just sick as a dog. They've got really hot face, their fever's 104, they were totally fine 2 hours before. What happened? This is a really sudden, severe onset of a fever. Something like aconite or monkshood. This is a plant that grows around here at the high altitude little creeks. It's a really toxic substance. It's used in Chinese medicine. But again, the way homeopathy works, it's on an energetic imprint rather than we're using the substance compared to conventional medicine not that long ago using mercury and arsenic as primary treatments for severe illnesses. So kids really sick. So aconite and belladonna would be the two main fever remedies I would have on hand. There's a couple other ones I go through here. Yeah, belladonna is, again, between the two, aconite and belladonna, they're hard to parse out, so I've made a little chart here. Aconite is much more restless. Aconite wants cold water. Belladonna is thirstless. They're like not interested, so like those ice chips or like the baths might be better for these kiddos. Aconite tends to have constricted pupils versus belladonna has dilated pupils. Aconite's really afraid of death, whereas belladonna is kind of out of it. And it's different. It's not the full-blown floppy baby situation. They're just like, as my friend calls it, fever dreams. They're just like a little bit, they're like in between the realm of like present and not present. Aconite tends to be on the left side, whereas belladonna is on the right side, and this can be a start. So we're getting into like some nuance here. Aconite's thirsty, belladonna is thirstless. Belladonna is more dull and delusional, whereas aconite is more acute fear and panic. They're really freaked out. So that 2-year-old I was talking about, or that 2 hours into it, they were totally sick as a dog, onset severe. That's generally what I would think about for aconite. These remedies can be found in health food stores. I think even Whole Foods carries them. In Montrose, Natural Grocers carries them. They're little blue tubes, the Boreon, or however you say it. 30C is plenty. What I find with people giving homeopathics is they don't give it adequately enough. One dose is sometimes okay, but oftentimes you need a dose every 15 minutes for an hour, hour and a half, and then things will kind of subside. The way homeopathy works is it kind of pokes at the vitality. Have you ever seen a dead plant? How do you know a plant is dead compared to a living plant? It's kind of brown and crispy and just dried up, right? Same thing with a living body. A human body has a vital force. It's the thing that that animates us, if you will. And when a kid gets sick, they tend to have a little bit less vitality, right? Because they're sick. That makes sense. The vitality is focused someplace else. So what we're doing with the homeopathy is like poking at that, saying, hey, vitality, remember, you need to clean up this mess over here on aisle 2. So that's what we're doing with the homeopathics. So Triple H, herbs, my favorite, my go-to. Hydrotherapy, easy thing to pair with. Most people have access and the resources at home. And then homeopathy, if you're getting a little more curious, you're on kid number 3 and you're sick of having to go to urgent care, it's a great tool to have on hand. I'm a big advocate for it. So that's the gist. That's how we take care of fevers without running to antibiotics. And I'm going to do an episode on antibiotic resistance and why we need to be incorporating more herbal medicine into our medicine cabinets at home, because I don't know about you, but I don't want to deal with superbug gonorrhea, and that's a thing now. The first case of this was found, I think, in 2016 in Australia. We don't want to deal with that. We want to be able to have antibiotics to take care of that. But every time you get an ear infection or a runny nose, that's not an appropriate time to have an antibiotic, even if your doctor says it is. I will just disagree. We've gotten into like this habit of just prescribing medication because we don't want our patients to feel discomfort. And as I've said before, we need to have a little discomfort so that we can reduce the amount of chronic illnesses that people are experiencing. So we kind of talked about disease as a process and the philosophy behind germ terrain theory duality coming together. You need to be susceptible and exposed. So if you're doing a good job taking care of yourself, it's going to be a lot harder for that bug to ding you, as we saw with COVID. Not always, but a lot of the time. We need a fever because it's the immune response. It's the body's way of dealing with that yuck, and it's trying to take out the trash. And then we come and meddle as humans because we don't want to feel like garbage. Feel like garbage for a little bit as opposed to a lifetime of chronic illness. And the importance of taking a temperature appropriately. The best way to do it is rectal. Most people don't want to do that. So the temporal artery little scanner one that's touchless works pretty dang well. Some myths about fever. The main one there, fevers aren't going to give you permanent brain damage unless it's a severe fever. And febrile seizures are generally benign, but you do want to get a doctor on board if your kid has had a fever that caused a febrile seizure, just to make sure there's nothing else going on with the nervous system. The 3 causes of a fever, generally bacterial, viral, and teething. That one always can get forgotten. How do we manage a fever? Triple H, herbs, homeopathy, hydrotherapy. And when do you seek care? When that kid is really sick, they're not responsive. That's the most important red flag after febrile seizures, is like they're not wetting their diaper, they're not paying attention to you. You need to get someone on board immediately. Get to the emergency room. And that's what we've got. I hope that you guys found this useful. Obviously, I'm really passionate about sharing how do we take care of ourselves at home without spending tons and tons of money and burdening the healthcare system when we really do need it available. But yeah, we've gotten uncomfortable being a little bit uncomfortable, and it's again hard when our kids are sick. So thank you for listening. Happy for you guys to share any comments you have.